Hi Thomas, I'm Alexis. I'm going to be your student physical therapist assistant today. And I looked at your chart and I noticed that you had a left embolic stroke 6 months ago. And I also see that you have expressive aphasia, which is all right. I'm going to try and communicate with you as best as you can. I'm going to ask you a few questions and just answer them to the best of your ability, okay? So with working on physical therapy, what are some things you would like to accomplish with that?
I know I want to work on stairs, and I also want to get back to volunteering.
Okay, yeah, so we can definitely work on those things. We're going to do quite a few exercises and interventions for all of that stuff today. We're actually going to start, and I'm going to actually try and activate your ankle muscles because I know those aren't working very well. So we're going to work on activating those muscles, and then we're going to go from there and we're going to strengthen your hip and your knee muscles to really help you with walking and all of that. And then we're going to work on some balance training, and we're going to work on stairs, and then at the end we're going to do some wobble board exercises, and I hope that at the end of the treatment you will feel like you can kind of walk easier and that you'll be able to actually go back to volunteering like you wanted. So let's get started.
Okay.
Alright, so we're going to begin with the treatments. So since you had a left-sided stroke, it kind of affected a lot of your right side and had it caused a lot of weakness in your muscles, and especially in your ankle muscles. So we're going to work on something called rhythmic initiation, which is basically a technique that I'm going to teach you to activate this muscle here, which is called your anterior tibialis. And we're also going to combine it with something called a quick stretch, and it's mostly to kind of get those connections back into your brain on moving your foot in the way that it should move. So let's get started. So all we're going to do is I'm going to have you, I'm going to move your foot in the way that I want the motion to look like, okay? So I'm just going to push it up and then back down. So this is the motion you want. And while I'm doing this, I want you to think of just bringing your toes to your knee, okay?
Okay.
So I'm going to do this a few times. But bringing your toes to your knee. Bringing your toes to your knee. Do it a few more times. Toes to your knee. Perfect. Okay, now we're going to incorporate your other leg. So if you want, you can just try and bring that leg right there. Yes, perfect. So now we're going to do the same thing, but I'm going to have you do that motion with this leg, okay? So you're going to bring your toes up like that, and I'm going to mirror that movement with this foot. So this is allowing you to see the motion that this foot is supposed to be doing, while this foot's actually performing the motion. You see what I mean? So it's allowing you to make those connections in your head on how your right ankle should be moving. Bring your toes to your knee, toes to your knee, toes to your knee. Good. Okay, so you can put this leg down if you want. And now we're going to do something called a quick stretch. So for this, all I'm going to have you do is we're going to do the same thing we did before, but I'm going to push your foot down a little bit. So I'm going to push it up, and then we're going to go back up. Okay? So I'm going to push it down, and then we're going to come back up. Down, push down, and bring your toes to your knee. Push down, toes to your knee. Push down, toes to your knee. Push down, toes to your knee. And the more that we do this, the more that this muscle here will start to activate, and this will help you with walking, climbing stairs. It'll help you overall with a lot of different functional activities. Toes to your knee, toes to your knee, toes to your knee, toes to your knee, toes to your knee. Okay, alright, now we're going to continue working on your ankle strength. So basically all this is you're just going to take your foot and you're simply just going to roll it on this all the way to the tip of your toes and then all the way back, okay? And we're just gonna do that a couple times, all right?
Okay.
So, yep, roll your foot all the way to the heel and roll it back. To your toes, to your heel, to your toes, to your heel, to your toes, to your heel, to your toes. And this is just emphasizing ankle range of motion and kind of helping continue strengthening those muscles that we're trying to activate. Keep going. All right, that looks good, and we're gonna do that for 3 sets of 10. So you can take a little break, and then we're gonna do it 2 more times, okay? All right, Thomas, so now we're going to work on strengthening your knee muscles. So all I'm gonna have you do is while you're in the seated position, I'm gonna have you just bring your leg up as much as you can, and then bring it back down. I know you don't have full movement in it, but just do as much as you can. Yep, and you're gonna be strengthening these muscles here, which is also very important for walking. So it's important to strengthen these. So do it 10 times. And then we're gonna do 2 more sets of that, okay?
Okay.
All right, so you're just gonna do that 10 more times. Perfect. All right, now we're gonna do the same thing to your other leg. So this one has full motion, so you can really try and go as much as you can with this one, yep. And then we're gonna do the same thing, we're gonna do 10, and then we're gonna do 2 more sets, okay? Okay. Okay, so now we're gonna work on strengthening your knee flexors. So all I'm gonna have you do is I'm just gonna have you bring your ankle up to your butt, if you can. Yep, if that's all you can do, just go back down. Perfect. You could go again. And you're just gonna do that 10 times. Almost done. Okay, and you can relax, and we're gonna take a little break, and then you're gonna do that 10 more times, and then you're gonna do it 10 more times after that, okay? And now you're just gonna work on strengthening the other side, so you're just gonna do the same thing, and you're gonna bring your ankle up, yep, and back down. And you're gonna do that 10 times as well. Almost there. And relax, and you're gonna do that 10 more times, and then 10 more times after that. All right, Thomas, so now we're gonna work on strengthening your hip muscles. So to start, we're gonna work on strengthening your hip flexors. So all I'm gonna have you do is I'm gonna have you bring that leg over the line. You're just gonna bring it forward like this. And you're just gonna do that 10 times. Down. Okay, and then you're gonna do the other side. going to work on strengthening your hip extensors, so all you're going to do is you're just going to bring your leg back this time instead of forward. And you're just going to do that 10 times each side like before. Okay? Try to keep it straight if you can, yeah. And then do the other side, yep. Yeah, there you go, that's better. Perfect, and then you're just going to do that leg again 10 times and the other leg 10 times. Alright, so now we're going to work on your abductor hip muscles and your adductor hip muscles. So now you're just going to face catch like this. So you're going to put your hands like this. This one, you're going to take the right foot and you're just going to bring it out to the side, okay? And you're going to do that 10 times. Good, and then do the other side. Hands go over a little bit, yeah. Good, and then you're going to do this side 10 more times and the other side 10 more times. Alright, and then the last one we're going to do is you're going to stay where you are, you're just going to bring that foot over the other foot. Just going to cross it, okay? Yep, just like that. You're going to do that 10 times. And then the other side. Just cross it over, yep. Perfect, alright, and then you're going to do 2 more times to that foot and then 2 more times to the other foot. And then we'll move on, okay?
Okay.
Alright, so now we're going to begin working on some balance because I know that you get kind of unbalanced when you're kind of walking, when you're in this position, and it'll help you overall with stair mobility and walking and all that stuff. So first of all, I'm going to teach you something called protective reactions, and these are important because if it'll teach you kind of how to maintain your balance if you ever feel like you're going to fall or anything like that. So I'm just going to give you a slight nudge from the back, and when I do that, I'm going to try and encourage you to use your hips to try and stop you from falling instead of your ankles, because I know that your ankle's kind of weak. So all you're going to do is I'm going to push you, and when you kind of fall forward, kind of just lean into it with your hips, okay? And then same thing when you go back, kind of lean into it with your hips, and then to the side, lean with your hips, okay? So just give it a try. You have your cane for some stability, and I'm right here in case anything were to happen, okay? So I'm just going to give you a little nudge and just try and use that hip strategy I told you. Just try and keep your balance, okay?
Okay.
Are you ready? I'm going to push you, kind of lean back. Yep. And then I'm going to push you this way. Yep. Go back up. And then I'm going to push you to the side. Yep. Back up. And then I'm going to push you to the other side. And we're just going to try and do this a few times, just so you can kind of get a feel of how, kind of like if you were to lose your balance, how you can kind of get yourself back up if you feel yourself falling, you know what I mean? And that will help you with all of that, okay? And to the side, yep, to the other side. We'll go over to the right, forward, and then back, please, to the other side. Alright, so now that we've kind of worked on your protective balance reactions just with your standing, we did that a couple times, we did that 3 sets of 10 as well. So now we're going to move on to a little bit more challenging stance, which is tandem stance, which means that you're going to stand like this with one foot in front of you. You're going to have your effective leg behind you, and you're just going to stand like this, and you'll have your cane. And we're going to do the protective reactions again, and we're just going to keep practicing that until you kind of feel comfortable standing with one foot in front of the other, and we're going to try and work on that, okay? So keep your effective leg behind you, put that leg forward. And just kind of try and find your center of gravity if you can. Alright, so we're going to do what we did before. I'm going to do it a little bit slower. Just try to use that hip strategy that I taught you, okay? So I'm going to push you just a little bit. Balance yourself out. Push you a little bit this way. Balance yourself, yeah. This way. This way. Continue to bring this back. Going forward. Alright, we're just going to keep doing this a few times. So you feel like you can maybe try it on, right? Okay, so we've done that a few times. I'm just going to try and have you, I'm going to have you stand like that, and I'm just going to try and have you kind of do it by yourself, okay? So just kind of stand there and just kind of lean and try and see if you can just kind of catch yourself, okay? So put one foot in front of the other. I'm right here if you need me. And just kind of see if you can stand there. You feel like working with the protective reactions kind of helped? Yeah, I think so. Yeah. Do you want to do it some more? Yeah? Okay. Alright, do it again. Okay, ready? Push your forward a little bit. Alright, so when you walk, I noticed that you kind of have what we call a decreased step height, so which means that you kind of don't lift your leg high enough when you should, and that also probably makes it harder to go upstairs. And the reason for that is because when you put your leg up, you have a hard time keeping your balance when you're on one foot. So what we're going to do is we're going to try and kill two birds with one stone, like they say. So you have your cane in this hand, and we're just going to have you, you're just going to bring your foot up, and you're just going to touch the top of this box. And that's going to help with increasing your step height. So it's going to teach you to go like this, and it's going to increase your single leg stance balance a little bit, okay? So I'm right here, in case you need me, and then you're just going to take that foot and put it up, yep, and then put it back down. And then put it back up, and put it back down, yep. We're going to do that 10 times. Down. Yep, you're good. Okay, that's done. Okay, and then you're also going to do it with your other foot, just so you can practice standing on that foot by itself. Now this one's probably going to be a little bit harder, so I'm right here. Yep. You do it slow, yep. There you go. Yep. Move on. Okay, and then you're just gonna do this side again, and then the other leg 10 more times, all right? And then we'll move on.
Okay.
Okay, Thomas, so now we are going to start working on stair mobility and ambulation. So first I'm just gonna have you show me how you would walk up the stairs using your cane. All right, and then you can turn around and come down the stairs. Okay, so now that I've seen how you walk up the stairs normally with your cane, I'm just going to teach you how you should properly walk up the stairs with your cane. So what you want to do is you want to lead with your left foot first, and then you're going to bring your right foot up, and then you would proceed to bring the cane up with you after that. All right, so that looked good, and then when you come down the stairs, you're just going to use your cane first, and then put your left foot down, and then your right, and then just repeat that process all the way down the stairs. Okay, now I'm going to teach you something called the D1 extension pattern that is used during ambulation and stair climbing. So all I'm going to do is I'm actually going to bring your leg back, and when you push off to go onto the step when you're walking up the stairs, this is the pattern your leg will be in. And working on this pattern technique will help you get a better push off when you're walking and going upstairs. So all I'm going to have you do is, while you're trying to focus on using this extension pattern, I'm just going to have you try and go up the stairs again. Okay, and then you can come back down the stairs, and we will move on to the next segment of the treatment. All right, so for the last part of the treatment, we're going to use something called a rocker board. And what a rocker board does is that it helps you a lot with trunk stability, and it helps you also with core strengthening, and is also going to help you kind of with your ankle strength and all that. And it will also help you with something called knee proprioception, which is knowing where your knee is and when it's moving. We're going to do both, so we can start side to side because that one's probably a little easier, and then we'll do it forward as well. Okay. So you're going to try to. There you go, and then just Alright, Thomas, so that concludes today's treatment. How do you think it went?
I think it went well.
Good. So I'm going to be seeing you a couple times a week, and we're going to continue working on all of your balance stuff. We're going to continue strengthening. We're going to really keep working on stair work, and we're going to hopefully get you back to volunteering and climbing stairs like you wanted to in the first place. So I look forward to seeing you again.
Okay.